Multiple myeloma has one of the greatest disparities in incidence and prevalence, with incidence in Black patients being more than twice that of white patients. Death rates are higher, and overall survival is lower in this group, largely attributable to access to care, delayed diagnosis, low representation in clinical trials, and lower use of effective, novel agents and stem cell transplantation. The American Society of Hematology and the France Foundation partnered to implement a certified medical education initiative delivered using the Project Echo Hub and Spoke model titled IMPACT, impacting multiple myeloma patients in African American communities. The Project Echo model offers community oncologists access to academic specialty clinicians through a series of virtual mentoring discussion sessions. As this project was implemented during the pandemic, a virtual format seemed the most appropriate to reach busy practicing clinicians. Our goal was to increase awareness of health disparities in Black patients with multiple myeloma, address barriers to care, and implement strategies to improve care for patients in this population. We recruited multiple myeloma specialists from 4 large academic institutions, which acted as our hub locations. We then recruited community cancer centers in surrounding areas near the hub to act as spokes for the project. Clinicians from the spokes engaged in the virtual mentoring sessions. The target audience consisted of community-based hematology-oncology physicians and allied healthcare professionals. There were 9 virtual mentoring sessions. Each session began with the hub site faculty presenting on a topic chosen for the month. Topics included genetics and epidemiology of multiple myeloma in Blacks versus whites, healthcare disparities in Blacks and having culturally sensitive conversations, differential therapeutic responses by race, clinical trial enrollment involving the Black community, financial toxicities and social determinants of health, how disease biology influences treatment decisions, perceived barriers in clinical trial participation, perspective from a patient advocate, and comorbidities of Black patients that impact their treatment options and clinical trial eligibility. After the presentation, learners discussed their own patient cases, receiving mentorship from hub site faculty, and creating a space for hub and spoke peer-to-peer learning. Following each session, learners were encouraged to develop an online action plan outlining detailed changes they plan to make in practice. We reached over 300 learners with this education and demonstrated increases in knowledge and competence compared to baseline in important areas such as health disparities in the treatment of Blacks with multiple myeloma, differences in therapeutic outcomes in Blacks compared to whites, and selecting appropriate therapy utilizing evidence-based guidance and individual patient characteristics. A majority of learners developed action plans related to learning objectives, such as addressing barriers to clinical trial enrollment and advanced treatment options and reducing health disparities in their institutions.
So I felt that these webinars gave us a forum to talk about the current evidence, the field, the problem, but also, very importantly, the solutions and building those bridges between academia and community physicians, something that we keep talking about, but don't have the tools to actually bridge those gaps. So these webinars, I really think, helped with that